Okay, so it's noon here in the East, 11 in the Central Time Zone, so we'll go ahead and get started. Um, my name is Sandra Seibel. I am the change lead for the Bridge Northwest program. So I work with our change specialist team as well as our Bridge Northwest leadership. And I'm hoping that today is a helpful session for everyone and that you get some of your questions answered and some information to take back to your sites. I will, a couple housekeeping things. The recording is started. We will be recording this session, including the Q&A portion. And then once the sessions are finished, so this is our fourth of 5 identical sessions. So after the session tomorrow, we'll choose the best recording and we'll put that online for anyone to review or to send along to people who weren't able to make it. We will also post a summary of the Q&As that were brought up at each group. That was an idea that someone had in the first group, and I think it's a great one. So we're gonna do that. Also letting you know we do have scheduled time for Q&A at the end. So if you have a question, you can hold on to it. We also have members of our change team who are here and happy to answer questions as we go in the chat. So if you do have pieces that you want answered as we go, please feel free to put them in the chat. The team will try to answer them. If they can't answer them, we'll try to get to them at the end. And if we can answer them, then we'll get back to you. I will say, if you have sort of very specific questions or very, maybe specific frustrations and you're feeling like you want to vent a little bit, just remember this is a public forum and a public space. So very happy to hear all of your concerns. And, if you want to do that a little bit more privately, we can certainly set up a time to speak to myself or your change specialist and talk through some of the things that are on your mind. I also will say that I'm fighting a cold, so I'm very hopeful that my voice will hold out for this hour-and-a-half session. But yeah, apologies in advance if there's any voice breaking or anything here. So we'll go ahead and get started. So today we're going to talk a little bit about the program itself from a high level, who's who, where we're at, some different pieces there. We'll talk about the working groups, how they were formed, why they exist, what working groups exist. We'll talk a little bit about barriers and supports. So what can we be doing as individuals and as organizations to assist in this program? Responsibilities, so different types of people here today, depending on your role, what might your responsibility be at this point in the program, and then where to get support. So if you are looking for information or someone to talk to, where can you go for that? And then of course, we'll have that time for Q&A at the end. So why are we doing this session? So back in October, we took the opportunity to survey our subject matter experts, and we had an excellent response. We had about 100 responses from across the region. People were very honest, and I really appreciated that. I think we heard some very consistent feedback from subject matter experts around there's a lot of confusion out there, confusion about the role, confusion about how they could be successful in the role, concerns about whether they were the right person to be sitting at the table, questions around communication and how that was happening across groups within the program, within organizations. And so as we looked at all that feedback, it became clear that we probably needed to have a session like this that was sort of open, people able to come, different levels of people, depending on how you fit in with the program in your organization, and just so that there's a bit of level setting for everybody. We heard loud and clear that workload pressures are really high and people were looking for support on, making sure that their managers and their leadership were aware of what was being asked of them and what this means for the departments and the organizations as a whole. But we were also very happy to learn that people felt, when they did reach out, people felt very supportive. And so that our team was sort of fulfilling its role in terms of, helping people through this process. And people really wanted, people really want this change. People really want to see this be successful and they want to help make it happen.
Again.
But just feeling like they need a bit. Oh, I'm just gonna ask anyone. Sorry, I'm gonna go through here and see if anyone's unmuted. Just gonna ask that people please try to keep their mics muted. I think we're okay. Yeah, that people are very supportive overall and really want it to succeed, but need a little bit more direction. So that's why we're doing this here today. So I want to start with a poll, and this is something that I'll work through Teams. It should show up directly on your screen. And just wondering about who is with us today. So it will be a select all that apply. So if you fulfill a couple of roles in your organization, please go ahead and fill that out. And we'll sort of see who's with us here today. This and all of the polls today are anonymous, so they're not tied to your name or your email in any way. So you can feel free to be honest in our polls today. Okay, so mostly subject matter experts, which is what we've found across the other sessions that we've done as well. Great to see some managers out, as well as some local delivery board members, and maybe a couple executive sponsors, which is also fantastic. Again, we do have members of both our Bridge Northwest and possibly one HITS teams here today for support in that. Let's give another minute or two. I see we're at 42 people and we've got 29 responses, so give it another couple seconds there. One thing I will also add is if you are in an office with a couple of people, or you're in a boardroom somewhere with a group, if you can please just put in the chat who's with you. If their name's not popping up, just we are sort of tracking who's come from different areas and things like that. So it would be helpful to us if there are multiple people with you. Okay, so that's pretty good. Looks pretty good. So a bit of a range, and we will talk about sort of all the different pieces today about how you can be supportive and be supported by the program. So the change curve check-in, this is something that I like to do at the start of lots of sessions that I do. This might be a concept that is familiar to you. It might be something that you've seen previously in some of our work, or maybe through other work that you've done. But essentially it is the emotional range that we all go through any kind of major change, whether it be professional or personal. And this is not a right or wrong thing. This is just the reality of how we react to change as humans, and it's absolutely normal for 75% or more of people to really start very firmly in that anger and blame and fear portion of resistance when they start thinking about a change. Humans, we like things to stay the same, and so this is where we start, and that the hope is that over time we can move through that curve. So the next thing I'm going to ask you to do is think about when you look at this curve, where do you think you're sitting today? When you think about expand, when all the things that already are coming, do you feel like you are sort of over in this resistance phase? Have you moved into acceptance a little bit? And again, no right or wrong answer. It's just about, sort of taking the temperature of where everyone's at today. Okay, so exploration, some fear and bargaining, absolutely. Also very normal for this stage of the program in terms of, we've hit you with a lot of information, a lot of big asks, a lot of, maybe problems or things that we need solving that we don't know how they're gonna be solved yet or how we're gonna do that. So very, very common. Lots of people in exploration, that's fantastic. Some people down here in depression, that's absolutely fine as well. It is quite overwhelming. Again, I'll give it another second or two for people to think about it. And this is something to, I like to do this with different groups, and I would encourage you, if you're leading a team that's going through this or you're talking about this with your team, it's really good to use a tool like this to sort of see where people are at, because the support and things that you give and information you give to people at sort of that resistance phase or this, phase where they might be really fearful or really upset about the change is really different than what you give them when they've moved over a little bit or when they're in depression. There's really different things that you give to people. So it's worth knowing where your team is at. If you're leading a team or a group that you're working with, it can really help to understand what they need. Okay, so thank you for that. So most of us looks like we're sort of sitting here in exploration with this fantastic sort of that willingness to give it a shot. The other thing I will say about the change curve is that it would be lovely if, once you were out of 2, you moved to 3 and so on, and you never went backwards, but we know that's also not the case. So it is very normal to, maybe you're in 5 today, but maybe after this session, you're like, nope, I've moved back to 4, or I've moved all the way back to 3. Given new information, given, a new piece of work that comes out. And so understanding that it is normal to move back and forth or to sort of jump between stages here. And so the next question is just to check in around, if you've been involved with this program for any length of time, how do you feel you've moved? Have you moved forward in this at all? Are you moving backwards? Have you not moved at all? Or maybe you're unsure, or you've just come in recently, and so this is the first time you're really seeing this piece. And I will say, we have had quite a few people say, I have moved firmly backwards. I was very excited, and the more I learn about it, the more sort of fearful I become, and I'm not really sure how to deal with that yet. And again, that's totally normal. Okay. So mostly move forward, but lots of move backward and have not moved. And some people just becoming involved recently. Good. Give it another second or two. And again, a good question to ask, just, not just where are you today, but how are you moving? Do you feel like you're moving backwards? And what do we need to do to be able to help you get back to where you're feeling a little bit more comfortable and you're moving forward on the curve? Excuse me. Okay. Okay, thanks for that. So I'll go ahead and move on. So I want to start today with a little bit of a who's who in this program. So a lot of times we will get questions about, I thought, don't you work for Meditech, or who's one? Is one the same thing as Bridge? How are all of these groups kind of interconnected? So I thought this would be a helpful sort of refresher on who's who. So the individual hospital organizations, or each of your organizations, are really the heart of this program. This is your program. This is why we're doing this program. And the leadership of all of these 12 sites across Northwestern Ontario, so all of our hospital organizations, came together and said, yep, this is something we want to move forward with. It's something we want to move forward with together as a region, and we want it to be a regional priority. And we know that we need to do this work, and we want to do it collectively. So while there is work going on individually at all of these organizations, it is also something that each one of these organizations has committed to working together to accomplish. So what we're looking for at the sites really is that local leadership, obviously frontline expertise. I mean, each of these organizations is unique and has unique programs, has unique staffing issues and requirements and things that we need to be aware of. So that's where we need, you know, people embedded within these organizations to tell us what's what. There's a lot of local work to do in terms of getting ready, getting information, making sure that things are going to work the way each organization needs it to work. And so that's where, you know, all of you come in as subject matter experts and as leaders in this process. So as these, you know, group got talking and was thinking about how they would accomplish this together, the 12 organizations got together and decided, okay, we are going to work together under what's called Bridge Northwest as a program. So Bridge Northwest is not a company. We don't exist separately. We are all employees of all of these organizations. We work, you know, for these organizations and within them. And we're basically just the overarching name and group that is helping to move this specific program forward, and hopefully in the future, more digital advancement programs forward. So this is really sort of the first bit for Bridge Northwest in terms of really bringing some transformation to digital health in the Northwest. So the group sort of leading the regional implementation, we have people that are, you know, working directly for the program, seconded from hospitals. I believe we have about 34 people working sort of full time on the program right now. We work really closely with our local organizations. So many of you will know you have change specialists, you know, our leadership, our working group leads, really trying to understand what the local context is and make sure that you're ready at your organizations for what's coming. And we provide sort of that day-to-day support and helping you understand how we're going to work together. Our goal is really not, our goal is so to not have 12 sites having to do things 12 times. So as much as possible, Bridge is, you know, the reason that we exist is so that we can do as much as we can centrally and collectively, and then we can sort of take that out to the sites and say, okay, this is the local piece that needs to be done, or this is the specific piece that we need each organization to look at. So we are trying to do as much as we can centrally to take some of the work and burden off of each individual organization, so we're not doing that process 12 times at 12 different sites. One Hits, they are a shared information technology service for all of Northern Ontario. So One Hits is its own company. People work directly for One Hits, and they are a membership-driven organization. So they currently have 35 members, 23 of which are live sites in the Northeast. So all the hospitals in the Northeast region are live with Expanse through One Hits, through waves 1 and 2. And then our 12 sites joined as wave 3, and we make up obviously the other 12 for that 35. So each individual site here is a member of One Hits, and part of the way of working that we've, you know, that was decided by our leadership was that we were going to join an already existing group, so that it, you know, it has advantages and disadvantages, but the advantages were many in terms of working together, you know, cost savings, clinical safety, lots of different things, and so we're working under that model. So One Hits is really responsible for that technical build, and I will clarify when I say build, if you are a techie person, if you know anything about software development, build sort of means something different here. So we are joining a system that is already built. Build is sort of what we use as an umbrella term to help most people understand like the way the system is being configured and set up for us. And they are working with SMEs through those working groups and through sort of Bridge Northwest to be able to understand the local needs and to set up that system for use in the Northwest. Meditech is the vendor, so Expanse is their software. They sell the software. They provide advice on the limitations of the software. So there are limitations to what the software itself can and can't do that cannot be changed by one. It can't be changed by Bridge. It's just a limitation of the product as it exists. And so they help us understand what those limitations are. They can also help us with some best practices. They use, they generally work with one for that. So if there is something we want to look at, is there a way to do that in the system, they will advise. But they're not involved in any way in organizational operations or regional decision making of any kind. They're basically a vendor in this process. This is the Bridge Northwest governance structure, and I won't go through it in detail. I just want to point out that in the working groups in all of these areas that we are working to collect information, give information, make sure that we're doing all the things we have to do. There are structures above that help us make sure that what we're doing is, clinically safe, it's fiscally responsible, it fits with all of the strategic planning that our sites are doing, and fits with overall, the guidance from the Digital Health Council, which is really the group that owns the digital transformation strategy for the whole region. We're making sure that our chiefs of staff are kept up to date, so they're aware of things that are happening from a physician, a provider point of view. And then our local delivery boards, which Summer you are on, this is a new structure that's really around making sure that all of the things that need to get done at the local level are coordinated and, there's good oversight there for all of that local work. And of course, making sure that, your senior teams are well aware of all the pieces that fit around this. So where are we in the project right now, or in the program? So we're firmly into stage 2. We're about eight months out now from our kickoff, which was back in April. And back then we were really still kind of in that planning stage, but we're really now into the sort of meat of the work. Obviously build comes first. We get into testing sort of, it'll happen over a long period of time, but we'll see more work around testing in that probably next spring, next summer. And then training really comes at the end of this stage, closer to go live, which is still slated sort of springtime 2027, end of March, early April-ish kind of. We don't have a firm date for that yet, but it will be, as we've said before, like a big bang go live, meaning that every site, all 12 of us, will go live on the same day. So whatever the date we set will be the date for everyone. And training will happen sort of just prior to that for staff, with a little bit before that, we'll do training for super users and train the trainer and things like that. So, we're at the beginning of stage 2, but definitely into a lot of the heavy lifting in terms of the work that needs to be done. And that will continue for the next 6 months or so. So where have we been? In terms of working groups, just wanted to highlight that, the working groups really came out of information that we got from one around what are pieces in the system, in Expanse, that need to be looked at from a specific lens. So there are workflows, there are policies, there are pieces that are really specific to different areas, and there are some that are much more general. So they kind of helped us come up with a bit of a framework of who needed to be in a working group, and that we did make sure that we included a subject matter expert from all sites, depending on, if you don't have surgery at your site, obviously you're not on that working group, you don't need to be. We did make sure we also had some informatics representation, people from One Hits and our Bridge Northwest support in terms of our leads and our change specialists. We did work with managers and Expanse leads to make sure that, we were trying to pick people that it made sense. They had deep knowledge of the area, they were a subject matter expert in. They had some decision-making insights, so how things sort of get decided either at the departmental or the local level, some really good local awareness. And I will be the first to admit we did not get this right every time. We still may not have it right. And so we're very committed to, working with departments, working with working groups or SNEs individually, leads. If there's people that you think need to come on or off a working group or need extra people or things like that, that's something that we're sort of constantly monitoring, and are always open to feedback on getting that done. So please know that it's not static in any way, and we can make changes at any point as we need to. And really the work that's been done so far is again around those core workflows. And the way I like to describe that is, we're all learning to drive, and we need to learn the rules of the road. So what we've looked at so far are those really big kind of overarching things about how does Expanse itself work? What are the rules about how you can use it? Where do certain things go? How do you do X or Z or Y in the system? And really looking for major gaps around, okay, well, we do this and the system doesn't seem to do that, or there's pieces here that don't seem to fit, and we were looking for those sort of big gaps. All of that was documented through our, documents within the working groups, question and answer pieces, homework, like sort of information gathering pieces that we asked the sites to fill out, and that you all have done an amazing job at getting us that information. So really just trying to figure out where the big holes were and how we might look at filling those holes. So this is the list of working groups sort of as it exists now or will exist shortly. So for example, like Indigenous Self-ID is a group that we're looking at forming now. We just talked today about a regional privacy group that probably needs to be on here somewhere. And so there will be more groups, I think, that get added now that we're past sort of that overarching piece and we're starting to look at some real sort of nitty-gritty details about things. It is likely that we will need more subgroups, I will say, of some of these pieces. So if you don't see your specialty here, if you don't see your name here, don't panic. In a lot of cases, that just means we haven't gotten to anything yet that is specific enough to you that we needed to pull you off the front line and have you in a meeting, which, we try to limit that. And we want to be respectful of your time, respectful of the fact that, there's limited time to care for patients anyway. And so we want to make sure we're using people's time really well. The other thing I want to point out about this is, so if you've been working, I'll just use health records as an example. If you've been working in health records and you've been on that working group, you may not be aware that at your location, there will be somebody on ClinDoc, dietary standards, outpatient, labor and delivery, emerge, registration, communications working groups. So there are people at your site for the most part that are on all these different groups. So if you are, again, health records, and you come across something and you're like, oh, I'm really not sure how the Emerge department would deal with this, there is someone at your site who's on the emergency working group who we can connect you with if you have a question for them, or vice versa. And so this is a little bit too for awareness of subject matter experts, that there are a wide variety of subject matter experts even in your own organization that you can reach out to, and I'll talk about that a little bit more later. So where does all that feedback go? So I talked about, all of that stuff that we collected. I think when we did our scoping exercise, there were something like 120 different sort of gaps that people found. And they said, okay, we want to look at this and understand what this means and where does this go? So it goes into one of two lanes. So if it's something where we need one hits to change something about how Expanse is set up, or it's a piece about how we're not sure what that's going to look like in Expanse, or it's a functionality piece, that goes into sort of this left column that one hits is responsible for. That's really around sort of what we're calling system changes, or things that have to happen within Expanse. So the working groups will be heavily involved in that, because that's the piece where, they're bringing you screenshots of something, demos of something, and you're saying, okay, this is a little bit different than what we do. How does this work? And figuring those sorts of things out. A not small proportion of those 120 things were actually what we're calling non-system changes, meaning, okay, I understand that this is the way you have to chart an expanse. It's not negotiable. That's the way the system works, but that's a big change for our staff. Like our staff will need training on that. They'll need to understand the implications for their workflow. They might need to physically move some equipment around to make sure that workflow works for them. And that has nothing to do with the software. It's more about workflows or policies or people or process changes. Maybe roles are changing. Certain people aren't doing certain pieces of the workflow anymore. And so that's going into this right column. And that's where we're handling it through Bridge and through the organizations. We have a group called the Change Network, which is really our expanse leads and our change team at this point. And we're starting to look at those and say, okay, what are some of these really big impact pieces that we need to look at regionally? And where can we do some work to, sort of if we're all going to have to change this, it's going to change everywhere. What is some work we can do to help our staff there? So depending, and this will be the model that continues as we go. So, if 3 weeks from now you identify something else, one of the first questions that the leads will ask is, okay, is this something that's changing in expanse or needs to change with the system? Or is this something that needs to change in terms of a workflow or a policy or a process, and it'll go somewhere else? It is really important that as organizations, we keep our eyes focused on both sides. So we really do need to be working on both of these sides simultaneously throughout this process, because both of these will take us to a successful go live. If we focus only on things that happen in the system, you can imagine it would be complete chaos on the front line as you actually try to put those into work, versus if we only focused on those workflow pieces and sort of ignored what was in the system, we would be in the same in the same problem. So we really want to make sure that we're keeping an eye on both of those things as we go forward. So what's coming next? I'm going to take a sip of water here for a sec. So over the next 2 slides, I'm going to talk about really what the work in the working groups specifically is going to kind of look like over the next 6 months or so. So 2 caveats I want to point out, really. One is this is sort of the next 6 months. There will be more work, different work coming as we get into testing and training and some of those other pieces. Also, this is not super specific to your working group. So again, if you are in a lab working group, if you are part of the ED working group, there's some very specific things that you will be doing that I probably won't mention here, but you will get more information in your working groups about some of those specific pieces. So any content that was flagged in sort of earlier stages that about needing review, go back and sort of talk through some of those pieces and understand, what is it that we think won't work? What do we need to do to sort of look at those pieces and understand what the effects will be for us? If you're in one of the actual new build, so we are building labor and delivery as well as long-term care for some of our sites. So if you're in either of those work groups, you'll complete the current state workflows. And moving on to how they compare to future state, or what we need the system to do future state for us. So the biggest work that'll happen over the next 6 months is really around dictionary and content validation. So dictionaries, the best way I can describe them is they're sort of these mammoth things that exist in the background so that Expanse knows where to route things, what different things are, how different things connect. And in the case of lab and pharmacy, these dictionaries are thousands and thousands and thousands of lines long. So they are enormous databases of information, and they need to be checked. So they need to be checked to make sure that we're not missing anything, that the stuff that we have correlates to what we're using now. And so again, the biggest lift for some of those will be lab and pharmacy. There are dictionaries that exist for diagnostic imaging, health records, registration, billing, a couple other places, but the biggest ones will be lab and pharmacy. And so I want to really stress here, and I'll talk about this later, that this is not a job that anyone will likely be able to do themselves. So it's a lot of work, and it's a lot of checking, and it's a lot of line by line kind of pieces. And so I would really, if you're here from lab or pharmacy, if you're involved in leadership, or even if you're on a local delivery board, there probably needs to be some conversation starting about how to support lab and pharmacy at your sites to get this work done, because it is very sort of detail oriented sort of work. I will also say I've talked to some people about maybe they were a pharmacist on the pharmacy group and they don't know anything about the dictionaries. That's not sort of their wheelhouse. And so they've said, you know what, I think it's best if I come off, we put a pharmacy tech on. They are much more in tune with pharmacy dictionaries and things like that. And that makes a lot of sense. So thinking about the homework asks that come through, thinking about, who is best to maybe do this. The other thing I will say is when we talk to people, if you have students, if you have other people in the department that may be able to help with this, you may want to get a little bit creative about who is helping with some of this work, as long as it's safe and that they're able to do it to the caliber that you need it done. I think you can think outside the box. It may not be your SME, it may be somebody else or somebody in addition to your SME. For content validation, so clinical documentation is sort of the overarching group that a lot of the subgroups fall under, and they will start to see, actually later today, we'll release what's called the I can't remember if it's called a clinical inventory or something like that, but it's basically looking at all the interventions, all the assessments, standards of care, all of those pieces, protocols that need to be looked at. And again, decided, does this apply to our site? What's missing? What do we need here? All of those different pieces. And so I would say for ClinDoc, it's the same thing. This cannot be done by one person. So if you have one person from your site on ClinDoc, they're going to need help. They're going to need a plan in the background for how to get some support with that and how to find the right people to comment on some of that. So if your ClinDoc person is from, let's say, MedSurg, and there's a thing about, renal workflow, or there's something about a pediatrics workflow or something like that, they're going to need some help from somebody in that area who knows about that piece. So we'll talk about that a little bit later, but those are two big places where you probably need to be thinking about how to get this volume of work done and who is best to kind of come in and support that. There will continue to be information gathering homework. So these are, when we send out and we're like, can you answer these questions for your site? Again, we will try to do as much as we can centrally. We will try to run this by people who may know first and then send you, can you look this over? These are what we think the answers are. We just need you to vet this. But there will likely still be the need for that, as well as, very specific one-to-one site meetings with one, where they're asking very nuanced questions for places like emergency rooms, surgical, things like that, because it is very detailed and specific for what each organization may need. Order set work will continue. So if you haven't heard about order sets, there are 800, I believe, order sets that exist with an expanse that can be adopted. It doesn't mean your site will adopt all 800, but they are available there. And for many of our sites, order sets are brand new. And so we're working with our order set committee, our physicians, our MACs to really understand, how do we get this done? How do we get this signed off? in a timely fashion to make sure that these order sets go through, make sure the right people are looking at them and all of that piece. And obviously, like the dictionary work ties really closely to order sets. So in order for an order set to work properly, you have to have the dictionary built in the background to be able to order things, labs, drugs, all those pieces. We'll begin change requests. So change requests is probably a term you may or may not have heard in your working groups. So when we have a piece on that left side of the diagram that I showed earlier, where we want to make a change in expanse, depending on the size of the change, so if it's something small that affects sort of your location only or your department only, usually that's something that can be taken to one hits, and they can look at it and potentially do that without having to go through a full change request. If you are requesting something that will change a process or something for multiple departments, multiple organizations, or it will affect any of the sites that are already live in the Northeast, it does have to go through a more robust process. And you can imagine, you probably wouldn't appreciate it if you're working away and the way your intervention works is the way you've always been doing it. And then all of a sudden one day it changes because somebody somewhere else decided they wanted it to change. So there needs to be a more robust process to be able to understand why the change is being requested. Is it a patient safety thing? Is there a new guideline that's out that, makes this old one obsolete? Are there pieces that are specific to your site or that are specific to our region that we need to take into account? So there will be a little bit of work with that. If you are bringing forth a change request on behalf of your site or your working group, we will work very closely with you to make sure that you understand, sort of what information we need and how that process goes forward. Again, that right side of the diagram that I talked about in terms of all those workflows and policies, that need to happen as we're doing changes on the left side with the system changes or the build. And again, that's our change network. So we're working through a process right now to understand what the highest priorities pieces are that we want to start working on collectively. And then the build team, as all of these things start to get put together, the build team, who is really one hits, they will start testing all of these pieces in the background to make sure that they're working the way they need to work. Eventually, we will get to a point where we are asking people at sites, different working groups, we're not sure exactly what that looks like yet, to test things, sort of front to back or portions of different workflows and things like that. So a testing plan will come out soon, and that will sort of lay out like what the different responsibilities will be in terms of testing. But again, this is sort of the next little bit and where we need to focus, generally for the next little while. So given all that information, if you have some control at your organization or you're talking to others at your organization, what should you be trying to do? So number one, think about the large volume of content validation and homework and dictionary and stuff that is coming. So what you really need here is a plan for how does a subject matter expert let everyone know what the homework is and who needs to be involved. How do you identify people that may need to be involved or that are available to be involved in different pieces as it comes out? And really this ties closely to point 3 there about that internal communication pathway. So having really good internal communication at your site between subject matter experts, between subject matter experts and their managers, between managers, and leadership, between the boards and the SMEs, and just think about all the different connections there. And also, your even up to your senior team. So making sure that all of the sponsors and people that are sort of making decisions for your organization's direction understand the amount of work that is going to be required over the next, not just 6 months, but there really is a ramp up. So we're starting up the hill now. As we get to go live, it will be all hands on deck, and that is all anyone will be able to focus on. It is an enormous undertaking. So by the time we get to, this time next year, there will be very little capacity for anything else in anyone's workload other than Expanse and getting ready for Expanse. In terms of sign off number 2 here in delegation, we really want to make sure if you are a number of people on a committee or on a working group, that you're working together behind the scenes to kind of come to a decision. So if you're coming to validate something, if you're coming with a piece of homework, that you've had some conversations internally about, what we're going to say, what we're going to decide, that you've gone through if there is any sort of sign off piece you need to get. So does your manager need to look at it? Does your local delivery board need to look at it? Like what is being asked of different pieces? And that will depend probably on the homework. It'll depend on, how, like how your organization wants to do it. So there probably needs to be a little bit of discussion about, what authority subject matter experts have to come and bring things from their organization. And I really want to say, I think this is something that the subject matter experts have struggled with, and they've done their very best to be those people for their sites and understand what needs to happen. And I think it's caused a lot of stress for them. And so if you are here as a manager, if you're here as a leader or from a local delivery board, please support your SMEs in understanding, what steps they may need to take to get homework signed off, if any, what authority they have to go back to their working group and say, yep, this is what's going to happen at Riverside, or this is what's going to happen in Red Lake, and just make sure that that's really clear to them, because they want to do a good job and they want to follow process. And I think there's just been a lot of confusion about what that is. And even within leadership, I think there's been some confusion at sites about what exactly needs to come to higher levels to be sort of looked at, or what is able to sort of be decided at a more ground level. And then the last piece is really thinking about, when we talk about 800 order sets, we talk about policies that'll need to be changed. We talk about, potentially training materials or pieces around process, SOPs, things like that. So think about how those things get approved at your site, and think about maybe needing an expedited process. And I think you will definitely need some kind of expedited process or some kind of understanding of how to move these things through quickly, because generally, I know these things can take a very long time, and in order for things to sort of roll for go live, there may need to be a little bit more of a streamlined process or a special process to take some of these things through, given understanding that there was a robust process to get them to that point, and then the approval just is another process that you need to look at. So strengthening collaboration. So these are just some ideas other sites have used, some things that we've learned from sort of lessons learned. But really, use these as appropriate at your sites. You may have others that aren't on here. If you do, please let us know. We're always trying to kind of keep tools in our toolbox that we can help people with when the time comes. So if you have sort of a standing SME touch point, if you are a smaller organization, you might be able to do this with all the SMEs at your site. Larger organizations, it might be sort of specifically people who are working on a certain piece of homework or something like that, but making sure people are able to kind of come together, ask their questions, get information from each other. Don't reinvent the wheel. So if you already have meetings, if you have manager meetings, huddles, senior team meetings, department meetings, make sure that Expanse is on there always. So as a standing item where you are talking about, is there any homework outstanding? Is there anything we need to talk about? Any subject matter experts that are in the group that want to talk about what they're up to. If you don't need it, great, you can move on, but it's great to have it there as a flag, and it just means one less meeting, one less other meeting to create. There will be a SME contact list available at each site. So your expense leads and your change specialists will have a list of all the different people on all the different groups. We are trying to keep those lists as up to date as possible. They may be on your intranet, they may be shared in a Teams environment if you have that. But if you are looking for information about, who is my SME from Emerge at my site, or who from Health Records is working on this at my site, certainly we can help you figure that out. If you do have access to Teams or any other kind of sort of consistent channel that your team likes to use, just try to keep things in one place. So it gets confusing when some things are in email and some things are in Teams and some things are different places, so try to keep it a little bit consistent if you can. If you're able to create, a like Lake of the Woods SME team in Teams, that can be really helpful because you can sort of post general updates and things and everyone can see them there. And if you do have channels like that, please use them. Please, if your organization sets something like that up, please do your best to check those messages and stay informed about what's happening at your site. Checklists have been really helpful. So if you have a piece of homework and you've decided, I need Emerge to look at this, or I need labor and delivery to look at it, or et cetera, you might want to make a checklist about either people or departments or something that you need to have look at it and sort of where people are at. Your change specialist can help you think about how to do this. Your expanse lead might have an idea. Even for things about, this needs to go through all these people, then it needs to go to our nursing quality council, or it needs to go to local delivery board before we can sign off on it or something like that. So think about, just having a bit of a checklist so then you don't have to think about it, sort of laid out there in front of you. And if anyone ever came back to you and said, well, did you talk to Emerge about this? Yep, it's right here. I talked to so-and-so from Emerge. That was part of the checklist. And then trying to chunk the work. So if you do get a piece of homework and you're looking to sort of get some support on it, if it's 4 tabs or there's 4 sections to it and you have a month, think about sort of asking for help a week at a time, saying, this week we want to do this piece of it and this week this part. We have found that people say, it's very overwhelming to get a giant spreadsheet and just say, okay, in 6 weeks get me all of this information. And so we have found that if you're able to sort of ask for pieces in smaller chunks, it does help. And that's something our team is taking away as well, in terms of any control we have over how things go out, that we're asking in a very specific format. Okay, let me give myself a break from talking here for a sec. We're going to do another activity. So thinking about all of the pieces that are coming, or all the things that we need to do. And this is a word cloud activity, so short sentences work a little bit better, but I will get all of this information in the background afterwards, so feel free to write whatever you like. But what do you see as some of the barriers to getting this work done? Either for yourself, for your department, for your organization, what is standing in the way? Time, yeah, time has been far and away the biggest thing for every group so far. Fear, that's an interesting one. Yeah, competing priorities, multiple projects, staff engagement, direction, expectations, staffing issue, normal day, probably just normal day to day. There's no time to get things done. Workload, urgent care, multiple projects, role clarity, different stages. Good. Very similar responses to everywhere else that we've heard. Yeah. Engagement physicians. Yeah, they're a sort of a special group that we're trying to work with a little bit differently. Fear, though. That's the first time I've seen fear, and whoever wrote that, thank you for your honesty on that one. I think that you're correct. People that resistance phase in terms of the fear and the anger in a lot of cases and is real, and it really does hold people back. And like I said, there are things that we can do to try to help people through that a little bit. A lot of it is sort of information and just listening, like understanding where that fear is coming from and trying to sort of help people understand what is changing, what will look different for them, what won't look different, and that sort of piece. So thank you for your honesty on that. Wonderful. Okay, we're gonna switch focus a little bit and we're gonna think about, so same question, but more from a, what can we do as individuals, as in our departments, as leaders, with our local groups, and that how can we help the work succeed? So what can we do that is going to make this work move forward well? Teamwork, collaborate, good. Reassurance, patience, backfill, teamwork, patience, positive attitude. I like that one. Dedicated time, managing workflow, pay the staff. Yeah. So looking at some of those backfill options or overtime or, bumping someone up from part-time to full-time if they're interested to try to get some of this stuff finished. Support, teamwork, sharing ideas. Yeah, that's a big one too, because if you're struggling with it, I guarantee you there is someone else in the region struggling with the exact same thing. So the more we can share ideas and best practices on getting some of these things done, I think the better. Dedicated time, excellent. Tech support. Wonderful. Okay. Thank you for that. I appreciate that, people, again, people do want this to work. I know, I'm sure every one of you are in that boat, even if you are in sort of that fear stage, that this is important, you want it to work, and that even the small things that we can do individually to help it move forward do make a really big difference for your colleagues and for your organization. So thank you for that. Okay, we're going to get into responsibilities. I'm just looking at the time. I'm going to go through these a little bit quickly because I want to keep us on time and have time for questions, but I'll try to do it justice. So really, if you're a subject matter expert, your main responsibility is really that content review or dictionary review or sort of whatever we're putting in front of you to sort of get done. We will use sort of standard trackers and things like that you're used to seeing in terms of, this is the piece of homework. We want comments. We want, is this going to work? Yes or no? Do you have this? Yes or no? So again, if you're struggling with the tech side of that, access, using the tool, please reach out to us. Please let us know as early as possible that the tool is not working or you don't understand the tool, and we'll help you work through that. And again, please start thinking about who else in your organization you may need to have on call, I will say, or in your back pocket in case you do need to reach out to somebody about an area that you're not, isn't your specialty. Please share information with your manager. There was some really significant feedback about, SMEs not feeling that managers understood what was going on, and sort of vice versa, managers feeling really lost in terms of when it came to, I'm not even sure what this person is doing. I know they're working away on this project, but what are they doing? So keep that information flowing. And again, think about how that works overall in your organization, and maybe talk with your group, talk with others in the organization about how this might look organizationally and how this can be improved. If you discover a gap, if you get involved in that change request process, please know that we will walk you through that. it may involve some documentation. It may involve a little bit of presenting if we need you to go and sort of give your information to a governance group, either for Bridge or for One, to help everyone understand, why you're so passionate about this change, or why you really feel that this is, a piece that needs to change. And we're happy to help you through that. And then keep asking questions, keep seeking clarity. The other thing we heard was people weren't really sure what was happening with their questions. They weren't sure where things were going. So if you aren't sure, if you feel like you haven't been listened to, if you feel like you're not really sure what happened there, please speak up. Go to your lead. If you aren't feeling comfortable with that, please come to me or your change specialist, and we can really try to help move people through that, and help you understand sort of where your concerns are going, or where, why something may or may not be possible to change, or where things ended up. So please let us know. Don't sort of sit in silence and suffer in silence. I would say if you have a concern and you feel like it hasn't been addressed, please let me know. If you're here as either leadership or manager support, please think about the engagement and the accountability for your subject matter experts. So talk to them about, what they've been asked to do, what that looks like, how much time they think that's going to take, help that they need to sort of get a piece done, or who else on the team might be able to help, or from other departments. If you need help with that, please go to your expanse lead or your change specialist to talk about, okay, this is bigger than just, the ED, or this is bigger than just med surg. We need to get other people involved, and we need a plan here. Again, talk to your SME. That communication goes both ways, so please try to keep up on that. If you have, obviously you're probably going to have networks in other departments that your subject matter expert may not have, or visibility into who to best to talk to, reaching out to another manager to say, hey, my SME really needs some help on this. Who do you think from your department might be able to help? There's ways to sort of use your connections there. And then just champion the change locally. We're really dependent on managers and leaders to support their staff through those phases of fear and blame, and really sort of, if you don't know the answer, please reach out and we can try to help you understand where your staff's at and what we can give to them in terms of information, in terms of reassurance. And so please just, if you're struggling, again, don't struggle in silence, come and talk to us, and we can try to help you through that. If you're an expanse lead, you're doing a ton of things. I know some of you at small sites are doing all of the above that we've talked about so far. So first of all, thank you for all of your work. You guys have done some amazing things and continue to do that. But your expanse leads are really there to sort of provide overall site leadership. So the expanse leads were really chosen by the organizations to sort of spearhead the program within your organization. They're involved in the local delivery boards. They're sort of helping manage that information flow. So who, knows about what, when, and where do different information pieces go. Trying to remove some of those barriers, identifying risks that come up. So again, their role is really as a little bit of guidance. So hopefully they can, if you're struggling with how to get something done, they may be able to help you understand who else can be involved or how that might get done at your site. Local approval processes, again, so thinking about, if something needs to go to a different council, or it needs to go to a different department, or it needs to go to a certain leader, they may be able to help you understand like what that process is and how we can get that done hopefully quickly within, a time frame that works with the program. Coordinating site decision making. So if there is site level decisions that need to be made either through the local board or a senior team or something like that, that they can help sort of coordinate what that looks like. And then acting as the voice in regional discussions. So, the change network is a good idea, a good example of that, but we also rely on our expanse leads, when we have a question generally about how things might work in the region. And then local delivery boards. If you're not familiar with this, this is a structure that was set up at each organization to sort of oversee the governance of the program at each site. So They are really tracking and executing local work. So they should have some insight into, what are some of the different pieces of homework that we're working on? What are some of the bigger asks? Where are people at with that? Are there any places we're struggling? Are there any roadblocks that we can sort of get rid of? Are there any decisions we need to make? How are we progressing with that? Enabling that cross-department communication. So again, coordination. If you're getting stuck in a certain place, the local board, the role would be to help, ensure that people are coming to the table who need to come to the table. So it's a bit of they are a bit of a carrot and a stick people. So they have some, maybe can dole out some consequences, but can also motivate people to do the right thing. Keeping that clear communication with your senior leadership. So if senior leadership is not on your local delivery board, please make sure you have some kind of mechanism to get them the information about what's happening with the program, what's happening at the local board level, even if it's just, copy of the report or something like that, but make sure that they're kept aware. Because again, the size and scale of this program over the next 12 months will basically take over everything that is happening at everyone's sites. It is that big and that all encompassing. And so as time goes on, that curve will just get higher and higher, and they will need to be aware of that. And then as we get closer to go live, there'll be some significant tasks for the local board in terms of making sure testing's getting done, all staff is being trained, go live preparations are done, all of those pieces. There'll be lots of local work to do there. So where do you take your concerns? Depends what your concern is. So again, if your concern is about how does Expanse do a certain function, what's it going to look like for us versus them, that kind of thing, that's really something to take to your working group, put it in the Q&A log, talk to the one build team. So people from one about what that looks like, they're really the experts on the functionality of Expanse. If it's something around, how's this going to work locally for us? Is this going to change someone's workflow? Do we need to get some more information from somewhere else about internally within our organization about something? Talk to other people in your organization if you can, or talk to your Expanse lead or your change specialist and figure out, who can I talk to about this at my organization to figure out what this looks like on the ground. If it's an issue with your workload, if you can't get your work done, you're just simply pulled in too many directions, please talk to your manager. Again, if you're having trouble with that, if your manager's struggling with that, reach out to us. Again, we may be able to come up with some solutions about, moving some work around or figuring out what we're going to do about that piece of homework or backfill support or something like that. So please start there. And then managers, I would say, or if you're having an issue around you're being asked to do something and it's conflicting with Expanse or there's resourcing issues, you simply need more resourcing, please go to your local delivery board and they can take those, again, if they can't solve it, they can either take it to the program delivery board, which is the overarching board, or they can take it to local executive if it's something very specific to your site. If you're not sure where it fits within this, or you're it doesn't really fit any of these places, just go to your change specialist. They're always happy to support you and happy to let you know where to take something next. So resources that aren't, people-based, sort of your Q&A documents, please start there if you're in a working group, even if it doesn't relate to your specific working group. So say you're in health records and you have a question about, well, would the nurses in ED see this blank, blank, blank? Maybe you have a question about that. Put it in your working group's Q&A, and the leads will make sure that those get to the correct other working groups as they need to. The other piece here is remember that those Q&As aren't immediately answered. So if you have something that's holding up your work, please log it in the Q&A, but then send an email to the lead of that group and say, hey, I put this in the thing, but I need an answer ASAP. It's holding me up. And that can help them just know that there's something they need to answer. Talk to your change specialist. Again, if you don't know who that is, on our website, we do have a whole listing of our change specialists, the organizations they work with, the the working groups they support as well, so please reach out. We do send documents from time to time, leadership playbooks. We've sent some SME memos, a playbook around the local delivery board. So please read those when they come your way, look through them. If you have any questions, please let us know. These are also documented on our website. So if you do need to go back and you can't, find something, you can always go there. Review the demo. So if you can't remember how something works, there's demo videos within your working group you can look at. If you need to look at a demo from another working group, reach out to your change specialist and they can help you figure out, what demo you might want to look at and how to get access to that. And then again, each other, please keep those communications open. Please try to sort of figure out who else is doing this work at your organization and how you can support each other. On our website, if you haven't been there, so it's bridgenw.ca. There's sort of a public areas, and then we have what we're calling member access area. You can access that either by login or by trying to go to sort of resources and training. It will ask you to log in, and it's a generic username and password for everyone in the region. So anyone who's working at any of our sites is free to use this username and password. It doesn't change. It will let you in. It will get you to some videos, some documents. That's where this recording will be and all of those pieces. So please feel free to share that widely. Anyone is welcome to access that, whether they're a SME or not. We also have virtual office hours twice a month. So we are opening this up to SMEs and anyone else sort of connected with the program. Please remember that these are general office hours. So if you have a very specific question about, something happening in your working group, chances are it won't be your change specialist that is there that week. So they may not be able to answer, but they may be able to help you understand what the next step is, adding it to your Q&A, talking to your lead, that kind of thing. But if you want some general advice, if you have a general question, you just want to check about what to do next, it's always the first and third Thursday of the month, always at the same time, always with the same Teams link. So once you get that Teams link, you can kind of come and go whenever you need to. And again, please talk to your change specialist about those. And given that there should be one tomorrow, or not tomorrow, Thursday this week, that'll be the first Thursday of the month.